Welcome back. Now, booster dose is now the new debate. Many are asking and wondering if Indians will be administered one, considering most of our population has still not received both doses. But it does appear that the World Health Organization is setting the stage worldwide for the booster doses. How will that really take place in this special report?
300 cases and counting. The Omicron is marking its presence every day. What is worse is that it makes even fully vaccinated people vulnerable. The demand for booster dose is growing louder with each passing day to tackle the long-feared third wave. After hedging for a long time, the World Health Organization has taken a stand on booster doses. It says introducing booster doses should be firmly evidence-driven and targeted to the population groups at highest risk of serious disease and those necessary to protect the health system. Several health experts, however, are recommending booster doses for all categories, with the vulnerable getting it first.
People tend to focus, particularly in the developed nations, right, on getting a third booster and a fourth booster and so forth. The fact of the matter is, until everyone is vaccinated, no one is safe.
I would focus on healthcare workers. I would focus on high-risk people. I would get them a booster. I don't think at this point, with limited supply, I don't think everybody else needs a booster right away.
With India, nobody has boosters, but I do believe that many people have had 2 vaccines and 1 infection. These 3 kits sort of can give you more of a protection.
The data from the United Kingdom-based experts suggests there was no rise in hospital admission and fewer deaths after boosters were given to the eligible population. The centre has maintained that vaccinating all with 2 doses remains its priority. It will make its final decision on boosters soon.
बूस्टर डोज के संदर्भ में हमारे एक्सपर्ट टीम ही तय करेगी और जो भी मार्गदर्शन हमारे एक्सपर्ट और साइंटिफिक हमें मार्गदर्शन मिलेगा, इस साइंटिफिक मार्गदर्शन के आधार पर हम आगे चलेंगे.
Will the WHO's new directive pave way for boosters for the weaker groups in India? The government says any decision will be based on science. With Milan Sharma in New Delhi, Bureau Report, India Today.
Listen in now to world-renowned experts, a top virologist and importantly one of the top South African doctors who first detected the Omicron variant. They are answering some of the questions you may be curious about.
For everyone watching, if you can simplify as much as you can, how and why is Omicron different from Delta? If people have to take precautions, what should they be keeping in mind in terms of why and how Omicron is different from what we've seen so far?
Particularly if you've had a previous exposure either to the vaccine or to the virus itself. Now, what does this mean in terms of protecting yourself? There are several aspects of this to consider. The first is that because there are going to be many people who are infected but who are asymptomatic or have a sniffle, we have to be more judicious about gathering. We have to be careful about the types of masks we use. So any mask is better than no mask at all, but the masks that seal properly and prevent you from breathing around the sides are going to be more efficient. The best of them are the N95 masks or the KN95 masks. If you have access to those, use them. If you don't have access to those, then double up on masks so that you're clear that you're able to protect yourself because less gets in and less gets out. So that's one thing I think that is critical. The other thing is that large gatherings are very risky. So if you assume, for example, that 10% of the population, some large crowd may be infected, the possibility that you're going to encounter somebody who is infected is much higher. Now, in this video that you're showing, some people aren't wearing masks at all. Oh, this is a problem. And we used to think that being outside was sufficient. I never really thought so, but there were people who did. But that's clearly not true if you've got a scrum of people who are all together exchanging air. That's the problem. So if you're not vaccinated, you must get vaccinated. If you've been boosted, great. If you're not boosted, get boosted.
Are you suggesting that the hospitalizations also right now seem to have come down?
Our hospital admissions is more or less stable. You know, it is. Let me just say to you that yesterday it was 663 patients across 660 facilities. And then the previous day as well, we didn't have high numbers. On the previous day, 105 people died, and yesterday 35. If you look at these stats, and again, our infectivity rate yesterday was 27.6%. So again, yes, it's a fast-spreading virus. We should never not acknowledge that it's fast-spreading. And in the beginning, we also saw doubling nearly every second day of our numbers. And then at some stage, it sort of stabilized and didn't double anymore. That's one thing that we have observed. The second thing is, if we say mild cases, we're not saying that those patients don't need any treatment. We're just saying that you are mild. We don't need to admit you. You don't need oxygen. You don't need a lot of medication. And we are also asking our patients to, when they test positive, to go and see a healthcare worker to make sure that they are clinically stable and all right. And if necessary, giving either prednisone and an anti-inflammatory just to try to, as much as possible, reduce the inflammation so that they can get easier, better. We have seen those patients that right from the beginning got some medication, especially around the prednisone. You don't wait 5 or 6 days, you start it immediately. Their recovery rate is between 4 and 5 days maximum.